Do you struggle with food addiction? Well, you're certainly not alone. There's a growing number of people identify as having food addiction, and it's noted to be up to sort of 20% of adults who can meet the criteria for food addiction. Even though it's not an officially recognized diagnosis, it's becoming much more prevalent and accepted within the medical community. But there's hope. So a new study published in Frontiers in Psychiatry from 3 different groups in the United States, in the UK, and in Sweden, observing their programs and reporting on their beneficial data, showed that there is hope. So let's get into the details and talk about what you can do if you suffer from food addiction. I'm Dr. Brett Scher, the medical director at DietDoctor.com, and I want to highlight this study called Low Carbohydrate and Psychoeducational Programs Show Promise for the Treatment of Ultra-Processed Food Addiction, published in Frontiers in Psychiatry. And it was put together by Jen Unwin, by Clarissa Kennedy, by David Wiss, and others, again, from 3 different clinics in the UK, in Sweden, and in the United States. And what they do is each program has a whole foods, low carbohydrate-based approach with coaching and counseling. It's a 10 to 14 week program, and it's for people who meet criteria of food addiction. And there really is an absence of published studies looking at programs like this and publishing their data. So it's kind of unknown. Do they really work? And based on this study, it seems like they do. Now, is it the counseling? Is it the group support? Sure, that's part of it. Is it the low carb diet? Yeah, that's probably part of it too. So it's the combination. It doesn't answer whether each one will work on their own, but certainly the combination works. And it suggests that it's worth trying, even if you don't have access to the group support. Maybe it's worth trying a low carb diet. So let's talk about the study a little bit. So like I mentioned, they had weekly sessions for 10 to 14 weeks, followed by monthly support. They measured different criteria, different questionnaires for sort of quality of life and for food addiction scores. And what they found was there was a significant reduction in food addiction symptoms. There was a reduction in what's called the craved score, which is symptoms of food-related substance use disorder. Body weight reduced, and mental well-being improved. And this is important. I mean, we hear so much about mental health and how people are kind of struggling with a decline in mental health and mental well-being. And even if it's short of a diagnosis of depression or other mental health disorders, mental well-being has certainly declined as far as we can measure. But this is something that improves mental well-being. So not only does food addiction improve, mental well-being improves. And to be honest, it didn't take much, right? It was a whole foods, low carbohydrate diet with some social support. And I don't mean to belittle it or make it seem simple, because the support was run by professionals, but it shows that it doesn't take much, that you can just follow a low carbohydrate diet, join a support group, and chances are that is going to help. Now, for your best chance, you join a professional group like this, but maybe even short of that to access it for the millions of people who struggle with food addiction, maybe just joining a local support group and following a low-carb diet is enough. I certainly think it's worth a try. Like, why wouldn't you try that, especially when we start to see data like this that improves food addiction scores and improves mental well-being and quality of life? So this was just a short video to sort of highlight this study. It's unique in the field. And something that is going to be on the horizon as we hear more and more about nutritional and lifestyle interventions for food addiction. And if you want another more detailed video about this, please check out this podcast I did with Dr. Vera Tarman about food addiction. All right, thanks a lot, everybody, and we'll see you here next time on Diet Doctor News on YouTube.